welcome to the Sustainable Business Council. My name is Susan Anderson. I am the Administrative Coordinator for the SBC. Tonight, we are here for our Sustainability Shot, our second one of the year. We'll have a third one in April. To begin with, I'd like to introduce the board members that we have here tonight from the Sustainable Business Council. There's Dawson here in the front, and Brandy, our board chair, is in the back. Lori is right around the back of the table. And Liz Dye is behind the bar right now. And Job is hiding down here. If you have any questions about the Sustainable Business Council, don't hesitate to ask them after we're all done. And for those of you watching tonight on MCAT, you can certainly go to our website, www.sustainablebusinesscouncil.org, to find out more about our entity. Tonight's sponsors are the Family Dental Group, Missoula Independent, Cherry Creek Radio, Portico Real Estate, and Energetics, and we'd like to thank them for their support. They make these events possible so that you guys can come and hear about all the interesting sustainability issues in Missoula. So we'll move on to our shot, which is reaching towards environmental sustainable healthcare. Our speaker tonight is Beth Schenk. She has been actively involved in the SBC for quite some time, and we really appreciate all the help. She is an RN with over 25 years of experience and a long interest in the environment. She's currently working at St. Patrick's Hospital and Health Sciences Center. And she's been working there for quite a while. Back in 1993, she started their first recycling program there, and that kind of ballooned into her becoming named the sustainability coordinator over there. And she is still currently working on degrees. She has a BA in botany from the U of M, a BS in nursing from MSU, and a master's in healthcare from Arizona State. She is currently a PhD candidate from Washington State University. So with that, we will ask Beth to come on up and share her insights.
Hello. Can you all hear and can you all see? Because you could come in. Okay. Well, thank you for coming, and I'm excited to talk to you about this because it is a passion of mine that's been a passion for a long time. And recently, we've had a little more success. So I mean we as the collective we, because for some reason, I would say mid the tens, 2000 to 2010, there was a little bit of a consciousness shift. There certainly was in healthcare. Things started to take off in terms of awareness of the environmental footprint of healthcare, what we could do, how it harms health, coming around full circle to kind of close some of those loops. So I'm going to just describe with you tonight a little bit about those issues. What are the environmental impacts of healthcare? What are the health-related impacts of that? What does healthcare do in response to it, particularly at St. Pat's, because that's what I know. Though I will also say that I'm involved with regional hospitals in Washington, Montana, and Oregon through our system, Providence Health, and we speak regularly about these issues and share ideas. I've also involved at a national level for Healthcare Without Harm, for Alliance of Nurses for a Healthy Environment, and for Practice Green Health. And we share all sorts of ideas about the challenges in healthcare. So I'll talk with you a little bit about that. But first, questions for you. What is interesting to you about healthcare and environment, or worrisome? Just yell it out.
That we see them as separate. We see them as separate issues. Like, oh, environmental health is an issue over here in this box, and like healthcare is over here in this box. It just seems like they're so inherently linked.
Biomedical refuse.
Biomedical refuse, like the syringes and body parts and stuff. Okay. Pharmaceutical waste. Yeah, because there's a lot more news about pharmaceuticals in our water, right, and in our animals and in the meat we eat and that sort of thing. Yeah.
How the increasing cost just isn't sustainable for most of us.
Yeah, which I'm not going to get too into, but it's really related. All of this is related, and it's related to our lifestyle in general, I think, too. But anything else?
Preventative healthcare versus healthcare after the fact.
Right. That's definitely related to this topic. Well, please interject whatever you would like to talk about or ask about, and I will go through these, and I tend to talk fast, so let me know if it's too fast. And also, this is my second time to use a Prezi, so we'll hope it goes. And I have to point it over there, I think. So, there. So this statement is basically what guides really my thoughts about this. We as some of you have said, we really can't be healthy if the planet is not healthy. It's not like the planet is some other thing that we encounter now and then. Every single thing about our life has to do with the planet. The air we breathe every moment, every cell we have, all the food we eat, anything we wear, it comes from the planet, right? So if things are out of whack, either from chemical exposure, from pollution, or from more fundamentally derangement of our basic planetary events, such as climate management, we get in trouble. So we don't make this connection in healthcare hardly at all. We make it more and more in our communities, especially people who are kind of paying attention to these things. So I just want to describe a little bit first about healthcare's footprint. And the first thing to know, that you already know, is how big healthcare is in this country in terms of an economic force. So right now, 18% and soon 20%. Now, there is movement afoot from our national reform efforts to change that trajectory. Will we? I sure hope so. It's hard to say, though. I know the expense is certainly unsustainable. The fact that we still don't insure millions of people is not sustainable. So those are issues that are not, I'm not going to solve, that's for sure. And I'm not going to talk about too much right now. But this is one reason why healthcare has such a gigantic environmental footprint as well. More specifically, I'm going to talk about 4 main buckets, and I'll describe this and show you a little model. And that is energy, waste, toxicants, and engagement. So energy first. I just want to point out that healthcare, especially hospitals, are super energy intensive, partly because they're open all the time. It's 24/7 operations. I often say that since St. Pat's has been here 140 years this year, this is an anniversary, and since electricity has been invented, St. Pat's has never been off. I mean, it just doesn't go off. Even when power goes off in town, it doesn't go off there because we have these gigantic diesel generators. Healthcare as an entity in the sector produces 8% of greenhouse gases. It's the second highest user of energy in terms of the service sector, so this is an economic category, the first being food. So food production, transport, delivery, preparation. So healthcare also has a gigantic piece, and that includes hospitals, clinics, pharmaceutical companies, home health, everything that would go into a healthcare bucket. So second largest user of energy in the nation. That's pretty impressive. Hospitals themselves are 2 to 3 times as energy intensive as regular office buildings. That's partly because they're 24/7. It's because we have regulations such as operating rooms need 15 air exchanges per hour. That's a health infection control mechanism. Patient rooms need 6 air exchanges per hour, so that's a gigantic amount of HVAC. So the HVAC energy is one of the biggest pieces of healthcare energy. I want to show you this. You probably can't read it, but I will explain it briefly. I think I have a pointer. The little yellow columns are electricity, and this is thermal or natural gas, and these are countries. So you see the 2 tall ones using a lot, Canada, US. So you see the others using less. This is an example that we can do better. So interestingly, there's a group who recently traveled to Scandinavia to study how they can do as well as they can in terms of energy use. And so they measure this on a category of kilobTUs per square foot. And so that's all energy, not just thermal, not just electricity, but both. Every bit of energy that they have, they measure it on a square foot basis. And so there's something I have in my slides later called Target 100. And that's because some of the countries in other places meet Target 100. That means 100 kilobTUs per square foot. The average in the Northwest, which has been studied and I know, is around 240. The average, the annual rate at St. Pat's right now is about 184. So we're better than average Northwest, but almost twice as much as Scandinavia. Some of that is regulatory, some of it is how they build their buildings to begin with, but the point is we can drive our energy use way down. Another category is waste. So waste in healthcare is complex. There's about 8 aspects of the waste stream, the way I think about it. It's usually quite regulated. There's a lot to consider. So these are the streams: solid waste, recycling, infection, et cetera. And the average production per day in the U.S. is 7 tons. Isn't that amazing? It's just a number you can't hardly comprehend. But as also is later in the slides, that equals about 33 pounds per patient per day. So the average household in the U.S. is 4.5 pounds. per day produced waste. The average in a hospital is 33 pounds per patient. And that's because people like me, who I work at the hospital, I'm not directly involved in patient care right now. I have been certainly over the years. But there's many aspects to making it happen that a patient gets cared for. That number of patients is not just inpatients, it's adjusted patients for outpatients and for ED and for clinics, et cetera. But it's really a tremendous amount of waste. And so infectious waste and hazardous waste, highly regulated, very expensive. Ship it to Dallas, Texas, some of our waste to be incinerated. Nuclear waste is very regulated. Our infectious waste, just so you know, gets shipped to Butte, Montana, where it's autoclaved. Then it's shipped to Great Falls, where it's buried in the landfill. So, a lot of issues with waste. Another category that I think of is toxic chemicals. So, healthcare also uses a lot of chemicals. Now, all of us are exposed to a lot of chemicals. And it's not just healthcare, but healthcare is a little bit more. And I know this because of a couple of studies that have been done. One was the body burden study for physicians and nurses. And they just looked at, this is a small study, just looked at about 40 nurses and physicians in Alaska, and I think it was Oregon, it was another state. And just did body sample testing, blood, not hair, but just blood. And looked at the exposure to common healthcare chemicals, and it was much higher than expected and much higher than the average person. What also I have read is that nurses are particularly exposed, the second highest exposed, first being janitorial staff. So that's just because of proximity to care, proximity to these chemicals that are used in cleaning and in care and pharmaceuticals and chemotherapies and that sort of thing. Another study that was quite interesting and alarming was more of an anecdotal study that asked nurses in retrospect what their exposures had been to different chemicals. So they had to think back over a week or over 2 weeks or over a month. And then they compared that to a similar questionnaire about miscarriage rates and birth defect rates. And sure enough, higher. It's not so surprising, but it is difficult to parse out which chemical, which exposure, which time. And so that's one of the reasons why it's quite complex to deal with toxic chemicals and knowing really what they lead to. I often say yes, but doesn't that just make you think, avoid most of them? We don't have to really know. But that's not exactly how science works, and that's not how commerce works, because commerce needs to know an exact answer in order to say we won't buy that anymore. Or there's a lot of pushback from the people who are selling that. So this is one of the issues. But we do what we can to decrease chemicals because of the impacts to patients, staff, community, and the natural environment, which is also our community. This is a list of a number of them, and I'm going to talk a little bit more about that. Oops, sorry. So how would you get started in a hospital? This gigantic place, we have 1,800 employees. We're the second largest employer in the city. We have a budget of about $500,000 a day, our expenses. It's just a big organization. We have a tremendous amount of waste, use a ton of energy. It's about a $1.7 million energy bill per year, and have all these chemicals. So how would you get started? So that was kind of my job. Though I was pushing for this job. As Sue said, my first recycling effort was in 1993, and that was before we used plastic bottles. So we only had to worry about aluminum cans. It's just amazing that plastic bottles are the thing now. We only needed one type of recycling container to catch those cans, and they're still around. But over my years of looking at this, thinking about it, studying it, learning more about it, I've come up with this little scheme that I call the UTI wheel. And I don't know if you can really see that well, but it's just those categories I talked about: energy, waste, toxic chemicals, all on a bed of engagement. So what's interesting to me about this is two things, really. This aspect of engagement. How do we talk about it? How do we teach? How do we get people interested? How do we find ways for people to exercise their own concerns? Because that's really a fact here. A lot of people in Missoula are quite concerned about some of these issues at home. Then they get to the hospital and have to waste 33 pounds a day, though ours is only 15. But this is a big part. Oops, hold on. This is a big part of the work of really having a program that works, that gets people involved, that will last for a few years, that we can measure things about. And then another thing of interest in this is these overlap areas. So in the overlap areas, it's sometimes, you may experience this in your own life when you think, well, gosh, if I'm driving, doesn't that mean, I'm violating my own principles of environmental sustainability? And if I'm driving, then, well, I might as well just use the chemicals, something like this. Because it's very hard to sort out. None of us can be perfect. We certainly can't be perfect in a hospital. But there are contradictions in what we do. But I like those contradictions because that means there's overlap. And the overlap is where you get more bang for your buck. It's also more difficult. So for instance, in this overlap area between energy and toxics, commuter transportation, fossil fuel dependency. So you could think about both of those. If you accomplish something in either one, you can do something about that, about both. Energy waste and toxicants, this one in the middle. These are just some things that I've identified that would fit in all categories. Electronics disposal, big deal. I was just telling folks tonight, we're going through a gigantic overhaul of our electronic system right now. It starts on January 19th. Everybody at St. Pat's is overwhelmed, and there are 300 extra people in town for it. And so it's a tremendous amount of electronics that we create, use, dispose of every year, just thousands of pounds. Energy and waste, if there are things that you can do that catch in both categories, that can be an easier, well, it's not easy usually, but it's a more productive way to start. So this is a way of just categorizing some of these issues. However, there's, of course, the way to categorize the issues in what they cause as well. So just to think about this, in case you're not familiar with some of this, energy in the US, about 85% of it is fossil fuel derived, and most of that is coal, though there is a fair amount of natural gas. And coal particularly is an issue for health, and it is because of some of these things. Mercury. Mercury toxicity it's a problem. Mercury is a potent neurotoxin. It's especially a problem for children. And once exposed, that stays in the body really for life. Not absolutely for life, but it's a persistent bioaccumulative toxin, so it creates problems. Asthma, another big problem. Asthma is just exploding in children these days. Part of it is because of chemical exposures. Part of it is probably because of hormone disruption. Part of it, I don't know why, but there's a lot of factors involved kind of in the soup of asthma, but asthma is a big problem for kids. It's expensive too. Cancers, heart disease, and then of course the climate change impacts, which we are just, we're seeing them more, certainly, in more measurable ways, but we're also starting to experience the health impacts more. That's from, do you recall our fire season this year? And we don't have a study about that for this summer. We're starting one. An intern that's working with us is starting one just to look simply at cardiac and respiratory admissions or visits to the ED or admissions to the hospital in those months, in those weeks. It was about a 6-week stretch. Then compare it to a less fiery year. There's some data that folks at the university have done from years 2000 and 2003, so we hope to add to that and just start to build more of a body of knowledge so that we can't deny this relationship, right? So that is energy. And then waste. Waste and health is a little bit less of a straight line, but there are issues. So with the body parts and stuff, it's not a huge issue now, but you may recall, it happened to be 1988, when the stuff washed up on the beaches in New Jersey. This started a firestorm of interest, which was a good thing. And there was a Medical Waste Tracking Act that happened for the next few years just to watch to see really what happened. And they didn't actually find that many problems, but it set out a laws that expected infectious waste had to be treated a specific way. And so that's state in all 50 states, and so we have to do that. Chemical exposures in waste are another thing that happens when there are spills, when there are issues from the toxins. Hormone disruption is another issue. Now, this is really complicated, and it can you can think of it in a variety of ways. So hormone disruption can happen from exposures to chemicals. It's very complex. It's not well understood, but there are a number of researchers working on it now, and they're looking at common illnesses like diabetes, thyroid disease. They're looking at obesity and its relation to hormone disruption of the body. It's not clear at all, and I can't claim that I understand it, but most of it is linked to some sort of either chemical exposure that was extreme or a lifetime of slow intermittent chemical exposures. And then also there's the whole question of chemical soup and how much we're exposed to at once and how those mix with each other. So there's a tremendous amount of research going on about that right now. And basically it tells me we want to avoid what we can, and we're surrounded. And everywhere around us we're surrounded, and I don't want to make us paranoid, myself included. But that's an issue. Resource depletion, in my mind, is really one of the biggest health factors about waste, though that is so many dots to connect. because really in the end, the way I think about it these days is that it is linked to biodiversity loss. So as we go through resource depletion, I mean, you have to think about, are we really going to not have food in this country? Not really. You know, I just read recently, you may have read it, about 50% of the food in the world is wasted every year. I mean, it's phenomenal. So it's not really a matter of quantity, but as we really disrupt our biodiversity, that unravels this intricate web of life that we are dependent on, and that really is the planetary world. And so I think that our really plowing through the resources in terms of a connection to health, that's kind of the connection. And then again, climate change impacts. Waste, it creates a tremendous amount of climate change impacts. We don't think about that. We think about waste as just something we're throwing away, you know, but as I say, there is no away. It's just really over in the landfill and it sits there for years. One thing I would really like to know is of the syringes that I myself have thrown away in 26 years of nursing at St. Pat's. It's got to be thousands, just me, you know? It's amazing. Okay, so then toxicants are more obvious. This is where we really think about environmental health. Environmental health is usually about air pollution, water pollution, or toxic chemical exposure. So this is kind of in the traditional world of environmental health, as opposed to thinking about ecosystem services kind of environmental health. And so we know that toxic chemical exposures cause all sorts of things. And then I like to argue, not argue, I like to put forth that engagement or lack of engagement in our own world, in our natural world and in our world with each other, also leads to health problems. It leads to a variety of health impacts, from anxiety and depression, sleeplessness, disengagement, loss of meaning, those sorts of things. And it leads to community stress as well. So a lot of reasons for us to be concerned about this from the health aspect. So, and I have to tell you right away that most hospital sustainability programs don't think about it really from the health aspect, I would say. I know Molly and I have worked a little bit together when she was at Swedish Hospital, and in our system of hospitals that I mentioned we meet with, most of the folks are wonderful. They're absolutely brilliant engineers and facility folks and whatnot, but it's interesting because I learned that when the processes that they wanted to affect got to the clinical world, they would say, oh, well, that's clinical, we can't do anything about that. And I was like, wait a minute, that's my world, and we have to do. That's where the rubber meets the road. That's where patients are exposed. That's where staff is exposed. So certainly we have to be involved in the clinical world. Let's see. All right, so what are we doing at St. Pat's? Sue mentioned my first recycling attempt, and so did I. Was 93. This is just a little bit of tiny history. We joined Healthcare Without Harm. We then later, you know, I had learned long ago that the first answer to any question is generally no, but you move through anyway. And so it took a long time. That's 14 years before we really got going in this issue. And that was partly because we had a request from our region of this Providence health system, and the request was to our president was, what are you doing about the environment? So luckily he came back to us from Seattle, and there were 3 of us who were working on this. And we said, let us tell you. And so that actually gave us a budget for the first time. We could start a program, we could get things kind of organized. And so that was in 2007, and we did this big rollout, and we got people engaged and started to set goals each year. We started to win awards. We started to do these annual sustainability reports, and I'll tell you a little bit more about some of that. But I want to point this out, which is something I leverage constantly at St. Pat's and in our Providence system. This is just a statement that goes with one of our core values. There are 5 core values: compassion, respect, justice, stewardship, and there's one more. But stewardship is the one I zero in on because of this statement. We care to strive wisely for our people, our resources, and our earth. And I'm so grateful that the sisters wrote this some years ago, because this is triple bottom line. This is what we do now in terms of sustainability monitoring and sustainability economics. So terrific. I say to our staff when I speak to them, we do a great job with people. We've got all these employees. People pretty much like working there. It's got good pay, good benefits. It's really a nice place to work, I think. We do a good job with our resources in terms of finance. We're solid. We're doing well. It's difficult times, but still we're a solid anchor in the society. And now finally, we're addressing a bit about our earth. So I'm grateful for that prescience on their part. So what are some of our programs? In energy and water, we always want to be an Energy Star hospital. We aren't always, so that's a fairly high bar. It means that you're using a certain specified amount of energy and water. We have been at both in our main building and in our smaller building, the Providence Center. So we continue with that. We have just been the beneficiary of 2 big Northwestern Energy rebates. The first was to redo our data center. So we developed a more green data center and had to replace chillers and then went to more virtual servers. That project alone saves $60,000 a year in electricity. So just right off the top, that's easy. And Northwest Energy paid for about half of it, so that was great. The payback on that will be less than 2 years. And then we just finished another one, even bigger, where we replaced a lot of pumps and fans in our whole cooling system and HVAC system. It's an interesting thing in hospitals. You have to heat rooms up and then you cool them down. So it's really just terribly inefficient. So engineers in the room like Martin would be driven nuts, but that's kind of how it is because we have comfort needs a few feet away from the need to have a cold place, the OR, the cath lab, the data room, that sort of thing. Groundwater cooling we've had since 1992, so that's something that's a lovely thing about our aquifer here. We pump water out of the ground at 48 degrees, goes through the chillers, goes back into the ground at 60. So that 12-degree temperature gradient chills our buildings all summer. So we can do that, use that, I'd say probably 7 months a year now. And that saves, the engineers say, about, that costs like 5% of what it would cost if we were doing that with electricity. So that's a great savings for us. This living roof pilot is not exactly an energy water thing, but it's just a little example we wanted to try. What would that be like? Would it grow? How hard is it to take care of? Could we use that effectively? Living roofs are beautiful, and I think they are helpful for energy management, though mostly in the summer. We don't have that great of a need because of our groundwater cooling. And they also really help extend the life of the roof surface. But anyway, it's very nice, and it's right by a big window, and people look at it. We have the Shut It Off campaign, which I've read that occupancy behavior alone can impact energy by about 15%. So that's what we do in our own rooms. That's turning off the vampire power, turning off the lights, turning off your computer, or monitor at least. The hospital, we ask people to leave their CPUs on, their processors on, and turn off their monitors. So there are things we can do. Taking the elevators, or the stairs, not the elevators. And then the commuter club. So we're working to have fewer people commute to work. This is a difficult one for a business, for us, because we get no gain from it. You know, it's easier to sell these things when it can save money. This one really doesn't. It increases health, we think. It increases engagement. Certainly decreases carbon footprint, but we don't exactly measure carbon footprint. So that was a little bit difficult for us, but we do pretty well. We have about we have close to 300 members and about 100 regular commuters. Oops. So waste, we do a tremendous amount with waste. This has been one of our big efforts. The first year I started tracking waste, we were recycling about 0.5% of our waste stream. And then that went to 8, and then 15, and then 21, and then 26. You don't need those details, but I remember them. And then finally in 11, we got to 34. My big goal was 25. I thought I would be shocked if we could get to 25%. This was in Missoula with no glass recycling and only recycling number 1 and 2 bottle-shaped plastics. Do you know how many plastics we have at the hospital? It's phenomenal. And so most of it we couldn't recycle. So this year, just a few months ago, as hopefully all of you know, Allied Waste is doing single-stream recycling. So we have moved to single-stream recycling. And that means we can take 1 through 7 plastics, rigid, not wraps, and put everything all in the same bin. So going from about 40 different units, asking people to separate and segregate and really do it right, to saying, nope, just put it all together, that makes my job infinitely easier for recycling. So we are expecting those numbers to go up. Infectious waste, as you mentioned, it has to be segregated. Well, it doesn't. You could autoclave all the waste in the world you want. The company would love that because they would make a lot more money. But it's quite expensive. Our infectious waste is about $120,000 a year to treat. And so if we can make sure that we're only putting in there what's actually infectious, that's a good thing for the hospital. So we've managed to get that down to quite a respectable number. Pharmaceutical waste is an issue. And it's really complicated. It's very interesting. There's a lot of research happening with pharmaceutical waste too, because you probably know that pharmaceuticals have been found virtually everywhere, even in our high streams. So isn't that interesting? And I am assuming that is either because they're very persistent and humans have carried them, or animals carry them because they drink water down low and go up high. So it's an interesting thing because they're not vaporized. I've asked pharmacists about this. They really don't go by air. So they've been transported on the ground somehow. So this is a really interesting issue. It's hard to say. It's one of those kind of soup messes. So we can't really clarify what are the health impacts of that because they're low exposures. Who knows who's had what and what their water is? Who knows if it's absorbed really in any other way through showers or whatnot? And I really don't want to alarm you about this. It's very small amounts, but the point is they're everywhere. And so then there's two questions. Okay, does that come through our bodies or is it through our waste? That sounds like the same thing, but it's not. So the first is our body waste. Is it through our excrement? And certainly there is some, because we don't process all of our medications, and we send some right on through. And then some of it is through what we throw out in terms of whole pills, IVs, anything like that. So we've really thought about this a lot. I've looked into this a fair amount, and I recognize that, well, people say different things. For one, the science is really not clear about that question, metabolic or waste. It's both. I don't know how much. I was at a conference once, and the USGS person there said 90% is through the waste, so the pills. And then the pharmacologist said, no, 90% is through post-metabolism. So it's very hard for like me here in Missoula and us at St. Pat's with the pharmacists, I work with the pharmacists on this, to know really what to do. But we do know that whatever, we need to do what we can. We also know that other states are developing laws about this. Montana does not have a law about it. I should back up. There are federal laws that meet hazardous waste standards. So there are a number of drugs. It's only about 30. It's not many. It was written in the 70s. It's an obsolete list. We know that similar drugs that are not on that list should be on the list, but they're not. So we don't have good legal guidance on this. But other states are developing legal guidance, and because we're part of Providence, we're moving kind of with the other states. So we're starting our pharmaceutical waste program in April. It's expensive. So this is something that I'm grateful the hospital wants to do. It's complicated, it's expensive. Nurses and others have to sort the stuff, and then we ship it to Texas where it's incinerated. But I think we have to do that, even though hospitals don't generate a lot of waste medication in terms of pills, but we do in terms of IVs. So in this case, all IV medicine goes into the bin and it gets shipped, which costs gasoline and fuel and incineration, but nonetheless, this is one of those areas where you sort out what's the most necessary. Kitchen waste, we do a little bit. We compost our coffee grounds, and we give food to the food bank. You recall in Missoula, we used to be able to give our food to the pigs at the Peas Farm, and then that fell through because of different laws, so we really can't do that now. SUD reprocessing is very interesting. That's single-use device. So a lot of devices in the OR or in the cath lab are designed for one-time use, built-in obsolescence. And so then you'd have to buy another one. And these are fine instruments. They're some of them are titanium. I mean, they're really good, high quality. So the FDA said these things could be reused. They created a list, and the things have to be inspected, cleaned, repaired, re-sterilized, and can be sold back to us at about half the price. So in 2012 alone, we saved about $500,000 doing that, and about 2 tons out of the landfill. So that's an easy win. Hazardous and nuclear are just other waste streams that are very highly regulated. We don't have much choice about that. Toxicants, so mercury-free. Most hospitals these days really have gotten rid of most of the standard sources of mercury, which would have been thermometers and sphygmomanometers. But not that long ago, in 1995, as recently, healthcare was thought to be 10% of mercury, source of mercury in the environment. You know about mercury and neurotoxicity, and why pregnant or women of childbearing age shouldn't eat fish and that sort of thing. That's mercury. And so we've been a mercury-free hospital for some time. Not absolutely free, but 95% free. DEHP is an interesting issue. It's a plasticizer. It's a softening agent that goes in IV tubing. It's not the only option, but it's the most common option. They say if you didn't have it, you'd have IV tubing like PVC pipe. And so this makes it loopy. But it's a hormone disruptor. This was discovered in NICUs or neonatal ICUs where young boys weren't developing properly their genitals. And so they looked at this and realized it was a hormone disrupting chemical. So a lot of places, there's no law about it. This is just if people care, they try and get rid of it. So I'm grateful that we've been able to get rid of this. We don't have a NICU, but still adults who are exposed to it, it can potentially cause a problem, so we don't want that. Cleaning chemicals are another big issue in healthcare, and part of it we have to live with because of the virulent bugs. This is the challenge of healthcare. We really can't expose, we cannot take risks for infection, though things are coming out all the time that are less toxic. For instance, hydrogen peroxide in rooms. They can fumigate a room, so that's a better idea. UV light actually works. So they're developing better, more potent UV lights that kill bugs in rooms. So that I look forward to. Triclosan is Pesticide used in all sorts of things. 76% of us have it in our bodies. It's just everywhere. It comes in our shoes. It comes in our cardboard boxes to keep things from growing that are shipped from overseas. And it's in the soap that we use in the hospital and in most hospitals across the nation. So we have worked on this. I've worked on this for like 2 years. And just this last summer, we were able to get rid of triclosan at St. Pat's. So I'm very pleased about that we are using a different chemical, but in about 1/3 of the places. It's thought to be a safer chemical. So anyway, that reminds me always of how difficult some of this work is sometimes. And then chemicals in foods is another big area in healthcare. A lot of hospitals actually have McDonald's or other fast food in their hospital. It's amazing. So we're ahead of the game in that regard because we have, really fine food. If you've been there, you'll enjoy the food. But it's difficult to move through local foods, plant-based foods, organic foods. It's difficult to do. We've made some progress and we continue to make progress. This year we had our first opportunity for a CSA, and that was very, very successful. We had about 60 people sign up, and we had over, I think it was close to 30,000 pounds of produce over the 20 weeks plus 3 more, so 23 weeks. And we hope to grow that next year. Different things we do in terms of engagement. We have all of these committees, so let's see, what should I tell you about? Well, the main thing I want to tell you about right now, because it's coming up, is the Turning the Tide Conference. So I don't know if any of you have been to that in the past years, but this is something that's a little bit unique about us here because we have clinicians who are working on this. I work with Georgia Milan, Dr. Georgia Milan, who you may know, physician, and this will be our 3rd year to do this, and it's really to discuss this whole area of where does human health meet the natural environment, and what should we be concerned about, what can we do to really change the way we interact with the natural environment, partly out of self-serving to protect ourselves. I don't think that's the only reason to care about the environment, but that's one that has a little bit of toehold. People can get some purchase on that. And so this year it's called Health on a Changing Planet, and we're looking at the health impacts of climate change. And one of my mentors, who's Dr. Jonathan Patz from University of Wisconsin, will be here, and I'm really excited about that. So that's March 8th and 9th. Let's see, so how do you measure this stuff? There's a lot to think about. I've talked about some of these issues that make sustainability in healthcare complex, but one thing I say to other businesses or to families is if this can happen in a hospital and we can do a 34% recycling rate there, it can happen in any business and any home because it's complex. And I've already told you a lot of these things, but we'll just talk next about how we work through this in our own place. It's really important in probably any business, but in the hospital, to have top and bottom involved. So it was really a grassroots thing for many years, and it took off when we could finally have some organized senior leadership who could give us money. So that was really important. And one of I mentioned when our president came back and said, well, what are we doing? And there were 3 people who said, we'll tell you. That was me, and it was the vice president, and it was our senior strategic planner. That's another very unique thing about our experience, because often people at that level have not paid that much attention to it. So we had phenomenal leadership. So that's important. Also, we meet with key directors just a few times a year. We don't do it every week or every month. We meet with other people every week or every month, but we set these goals each year. We have a healing environment committee, which looks more at the patient experience in the hospital about, are people being nice? Are the signs clear? Are the colors okay? Are things in good repair? Are there respite areas where people can get some peace of mind? That sort of thing. And then we have the Green for Good champions. Our program is called Green for Good. And the champions are volunteers who get out there and, we were the ones who went around and put new bins in the sold utility rooms last week for the single stream recycling. And then I have waste shepherds. So these are folks who actually understand the waste. And so they're the experts out there because it's complex. The waste stream is complex. When people say, really, I can't recycle this, but I can recycle this. And so that's what they do. And we set goals. I'd like to just say a little bit about this Practice Green Health organization. It's a great advocacy group. If you're interested in this at all, check them out and check out Healthcare Without Harm. And we aim for the goals that they set, basically. That's one of the ways we set our goals. Also, the Healthier Hospitals Initiative, if you're interested in this at all, it's probably more technical than you are, but they have 6 main categories, and we align with those as well. And then I base it on this UDI wheel that I just told you about. So, Our goals in the long run, this is not every year, but Energy Star would be great every year. Target 100. I don't know that we'll get there in this building. I really don't. If we're at 184 now, I don't know that we will, but that's always a goal. To reduce use and cost of energy each year, and to continue to work on our computer power management. That's a real gap for us. We can do better at that. It's all based on occupancy behavior. We don't have a centralized program, and you really can't manage your energy that way. So that's something that's hopefully coming before long. Our goal for 2012 is 35%. I just set the goal for 2013. It's 38%. I don't know our 2012 numbers yet, but I bet it's over 35%. And so we just continue to set goals like that. I told you that the average pounds per patient day was 33. We're at about 15. That's terrific. This is the number overall that we really want to drive down, because recycling is fine, but we want to avoid in the first place. We want to reduce in the first place. So this is a decent metric for that, and that we can compare ourselves to leading hospitals around the nation. Infectious waste, the average per hospital is 5 to 7 pounds per day. We're down around 1.5. So that's because of good segregation. So that's just good employee behavior, and it saves us money, and it saves energy as well. Toxic chemicals, the sorts of things we try to do each year, or change out adopt 3 green cleaning modalities. So these are things like floor cleaners that really use steam only and not chemicals. It's microfiber mops. It's a hydrogen peroxide solution instead of a bleach solution. So it's things like that. It's to some extent certified, green cleaners that are legitimate. But we do have difficulty there in the high-touch clinical areas because of infection control. So that's just something we accept. I accept, finally. And yet in our non-clinical areas, there's no reason to have those there for the most part. So we're doing better about that. Want to increase local foods as much as we can, and reduce these that are much harder to get rid of. So this is formaldehyde, brominated flame retardants, which are basically everywhere. It's hard to get something without them. You almost have to buy organic fabrics, and it's difficult. And PVC in general. PVC is not harmful really in use. It's fairly inert in use, but it's harmful when it's created and when it's destroyed. And then engagement, just want to always increase everything, increase the commuter club. We do a lot of communicating with each other. We want to grow our CSA, and this is a new thing in the last couple of years. Home base is our employee health, and there's interest in the hospital to increase the health of employees. It's a wonderful idea, and because we're self-insured, we're finally financially incentivized to do that. So I think sometimes of two worlds. The world in the public, healthcare is not incentivized to prevent disease. Healthcare is incentivized to have disease. It's just, it's terrible. But in the world of employees now, finally, and recently, we're incentivized to actually increase the health of our employees. So that gives me a foothold, because I can work on chemicals, I can work on exercise, and therefore commuting. I can work on a number of things that really overlap well, as you were pointing out, with the environmental health, with environmental sustainability, and with our own health. So I'm grateful for that, and somewhat hopeful that that will also happen in the public world. I think it does through government programs, more so than through private pay programs. So future goals, always thinking big. This is an interesting one for me, anesthesia gas. So anesthesia gas is very potent greenhouse gas, up to 3,600 times as potent as CO2. Nobody talks about that. We don't talk about it. We don't have a way to capture it. We can't capture that in this country. There's a product in Canada, I heard about it at a conference, that they can capture it, recycle it, bottle it, and resell it, except they don't have approval to do that. But that will come. So their equivalent of FDA does not approve of it yet, but that will eventually happen. In the meantime, this anesthesia gas is considered something we don't want to expose ourselves to, so we vent it out of the rooms, but it just goes into the atmosphere because it hasn't been well observed. Isn't that amazing? Some of them are lower in terms of their greenhouse gas potential, but very long half-lives. So this is an underappreciated risk. Love to do a green roof expansion. We'd love to get to target 100. Love to do greenhouse gas tracking. This is something, this metric is not that useful to us. We've tried it a little bit, but it's not the language we speak yet. And until there's a carbon tax, I think that's going to be a difficult thing for healthcare to really get their arms around. Now I'm hoping, because you all hopefully know, you may not know, but the greenhouse gas assessment for the city is now complete. I can announce that because I was on the committee. and it will be announced at the City Council meeting January 28th. And so with the UM's work on greenhouse gas and with the city's work on greenhouse gas, I'm hoping that that may start to be a metric that people can understand in Missoula and talk about in terms of, you know, these larger entities. Would really love to have more people commute. Now, this is one of mine, you know, I'm a big commuter. It bugs me that you know, it's only 100 people out of 1,800 people. I'd really like it to be 600 people. That's what this would be. It's just a goal. And then I'd love to see 20% of local food. That's a difficult one. Want to get to food composting. So EcoCompost is interested in food composting. They said when I talked to them a few years ago that they would need about $1 million to have a Quonset hut in order to manage the rodents. And so that's a legitimate problem, difficult to do. That would be a great thing if we could partner together somehow to make that available to Missoulians, and especially to large places. We can give some of our food away, but some of it, once it's been exposed, we can't do that. So I don't know if you all know about Blue Wrap. It's called KimGuard or Blue Wrap, and it's this ubiquitous polypropylene number 5 wrap that's very convenient to use for painters and for kids' art projects and whatnot. But we create it by the ton. I mean, just tons of it. We have no way to recycle it. And this is just one of those things that bugs me. It bugs people around the nation. People have made beautiful dresses out of it and art shows and different creations because they also don't know what to do with it. Some cities can. Portland, Seattle, and other places can. We really want to work with vendors to reduce or eliminate packaging. That's one of those BHAGs that it's going to take a long time, but we're making some headway here and there. And a recycling goal here in Missoula of 50%. Those are goals. Toxicants, eliminate more and more and more. Reduce our pharmaceutical waste. Really love to have more of a yard without herbicides and pesticides. We use not that many, but we use some. And you can always tell because the grass is so green and flawless. And I'd really like to have 20% of our food at least to be chemical free. It doesn't seem too much to ask, does it? Engagement, again, to just keep doing everything we're doing, but I want to point out this one down here because one of you mentioned this. I think that's hospital sustainability is great and it goes so far, but really until we change the way we think about our health in relation to the natural environment, it's kind of like cleaning up messes, you know? So we really need to fundamentally change the way we think about that. And that one word that has been used about that is ecological medicine. And it's not just for physicians, it's for nurses and physical therapists and pharmacists and all of us to be more aware of really what our impacts are, how harms to the environment hurt us, and to really close those loops a little better. We're doing a little bit about this, which right now basically is creating a document that just has some top issues that we would like providers to be aware of. Some of them are chemical exposures, some of it is radon exposures. Radon is the leading cause of lung cancer, and about half of the homes in Missoula have radon in them. We're exposed to it a lot here. We don't talk about that, we don't think about it. You know, it's not the most pressing, but it's one of those things we should address, and primary care physicians and nurses could address that. I do want to point this out because this is coming up soon, and I already mentioned that to you. So one thing we've done, you know, St. Pat's is a Catholic hospital, as you know, so what we've done on Friday evenings of this event is had a spiritual panel where we've invited people from different faiths to talk about a particular issue. The first year our conference was general, and our question to them was, what does your faith tell you about care for the planet? Last year our conference subtext or sub-theme was, what is our obligation to the future? So we asked them each to say, what does their faith tell us about that? What should we do? What is the guidance? This year, our theme for health impacts, as I mentioned, is climate change. And yet we recognize immediately that it's a difficult topic. We don't talk well with each other about climate change. It immediately goes to polemics and to politics and to economics and to very difficult. And yet if we're studying the evidence, we got a problem on our hands here, and we don't know how to talk about it. So what we're doing this year is the morning will be spent talking about health impacts, and we'll have this fellow who I mentioned is one of my heroes, and then also Dr. Reese is going to talk about infectious disease impacts. Dr. Milan will talk about coal impacts. Dr. Kevin Dorr will talk about mental health impacts, and Dr. Phyllis Eide will talk about community health impacts. So we have some great folks to talk. And then we're shifting to talk about how difficult it is to talk about. So we have a few people that will help with that and lead some workshops in the afternoon. So please consider coming to that, both the Friday evening event and the all-day Saturday event on March 9th. Okay, now, I've been talking a lot, and it is 7. I have these questions only if there was something that you'd like to talk about, just because I'm curious about this. What other goals should we consider? And what are your interests particularly, and what further information would be of interest to you, or anything you want to say?
In terms of employee health, stress is one of the biggest health impacts right now. So adequate staffing,
Yeah.
especially in the nursing area, I think is excruciatingly
Yeah.
under.
Yeah. Underappreciated, yeah. Well, I think that it's a really interesting conundrum, the staffing, particularly for nursing. I know a little bit about nursing staffing, and it probably applies to all. But it is such a balance and such a mix, and it's getting tougher. The dollars are getting thinner, and the acuity of patients is getting higher. It's really amazing to see what happens in regular hospital wards, not the ICU, not the ED, not the trauma units. And it's a very demanding job. It really is. And I totally agree with you about that. I think I also want to talk a little bit about stress, because my reading says that stress is, if we really handled stress better, we would prevent a good majority of our diseases, What Georgia says is about 70% of primary care visits are related to stress. There's some reason for stress. When you start to think about stress for employees, you think about, okay, hypertension, anxiety, depression, sleeplessness, hormone disruption of different sorts, like diabetes can be put over the edge a little bit by stress. And you think, okay, if you could invest in actually stress management in a significant and effective way, what would that do? So we're actually going to try this year to do a little bit of MBSR, mindfulness-based stress reduction for high-risk employees. So this is just a little trial we're going to do for, it's an 8-week program. You may know about it. It's taught here in Missoula at Red Willow, and we're going to be teaching a little bit at St. Pat's. And it's for this reason. It's because stress it's really a killer. I mean, it's not just that you feel bad. It's not that just that you're upset. It's that it actually disrupts your body. It makes your blood vessels less flexible. It makes your organs more exposed to hypertension and other issues. It elevates your catecholamines so that you have more stress hormones running through your body. It does a lot of things that we are better without. Now, you need some stress sometimes, but that's when you need to run. You need to burn it off. You need to do something. But the kind of stress that we live a lot with in our modern society is generalized stress, so that we're in a fight or flight mode most of the time, and it's not really in response to a rational reason. So anyway, I think that's a great point. Yeah.
Beth, I would be interested a little bit in numbers in terms of dollars, since our country is focusing on that. Since 2007, you've implemented a lot of programs. Can you say something about dollar savings for St. Pat's?
We are up to probably about $600,000 a year in savings. So every year we save that much based on these programs. Now, there was an article that came out recently that nationwide thought that if we all worked on most of these, and the big one is energy, if we worked on conservation, it's $15 billion for our national health care. Some of those cost money. You don't get paid back in the first year, but I mean, it's not that hard. You get paid back in 2 or 3 years usually. It's really quite worth it.
And would you say it's because St. Pat started in 2007, such a program, that you have such good numbers now compared to the averages? I mean, your St. Pat's averages were way better than average national averages.
Yeah, well, I will just let you know that we are actually a nationally recognized hospital for this work. So we are a high performer. We're one of about 35 hospitals that have been recognized at the highest level from this advocacy group I told you about. And it's not easy to do. So you have to have all these things in place. The minimum recycling rate is 25%. And like I said, when we started, it was 0.5%. So yeah, we've really made a lot of progress. But it takes persistent effort, and it takes, all these things I've described. Yeah. Great. Anything else? I know we're about at our time. All right, well, thank you so much.
Half a second, everybody. You guys all beat me in thanking Beth. We really appreciate your time and effort. Thanks, Beth. I wanted to mention to everybody here and those viewing on MCAT, Our next event is going to be what we call Capitalism 2.0. Sustainability is the big picture. We are bringing Steve Littman, who is the Director of Corporate Citizenship for Microsoft, here in February. He will be here on the 21st and the 22nd for a variety of events. There are 3 big public events that he's also, this is co-hosted with the U of M School of Business, so he'll be talking to some classes and things that aren't public. But the 3 public events are a reception on Thursday the 21st from 4:30 to 5:45. It will be in the Gallagher Business Building on the Guyanchetta Plaza, which is the 2nd floor big atrium area. And that one has a small charge. It's $15 for members or students and $25 for the public. We don't expect more than about 50 people there. It'll be your chance to actually speak with Mr. Littman one-on-one. After that, at 6 o'clock, downstairs in the Gallagher Business Building, room 106, we will be having his big public lecture. Should run from about 6 to 7. He's entitled it Sustainable Business, How Do We Scale It in Time? And then Friday morning here at the Loft, we will have the final event, which is Technology Meets Sustainability Forum. In addition to Mr. Littman, we will also have a number of folks from Missoula in various sectors of technology. Beth Schenk will be back that day. I understand that we also have Neva Hassanen, who is a proponent of sustainable agriculture, a professor over at the university. We will also have Brian A. Schwann from the Biomimicry Institute, and who was the last one I just arranged? Sorry. There are a number of other folks that will be out on our website by Friday. You'll be able to see that. And again, you'll be able to register for the 2 paid events, the reception and the technology forum. Both have a fee. The registration forms should be up by Monday of next week on our website, www.sustainablebusinesscouncil.org. So go out there to find out more details about the event. We're really excited about it and hope you guys can all join us there. And I do, for those folks here tonight, I have a registration form if you want to do it manually rather than online. So thank you all for coming tonight, and we hope to see you in February.
Yes.